This video will present the anterior draw test. This test is used to detect the presence of an anterior cruciate ligament insufficiency. To perform this test, the patient lies supine with the hips flexed to 45 degrees, the knees flexed to 90 degrees, and with the feet lying flat on the table. The examiner sits across the dorsum of the foot of the involved side to stabilize its position while grasping the upper leg with both hands, resting the thumbs either side of the patellar tendon. The examiner then pulls the upper leg forward and observes and feels for the extent of tibial displacement. Tibial displacement of about 5 mm is considered normal. Displacement of more than 5 mm or more than the uninvolved side is a positive test indicating anterior cruciate ligament insufficiency. It's important to note that in acute injuries, the anterior draw test is not accurate and therefore less useful because joint effusion prevents visualization of the displacement, hypertonic hamstrings resist the forward translation, and the posterior capsule and the medial collateral ligament serve as secondary restraints. In chronic injuries, however, the anterior draw test becomes more accurate as there is no inflammation or muscular hypertonicity and attenuation of the secondary restraints has occurred. Another important consideration is that prior to performing the anterior draw test, the examiner should look for the presence of a posterior sag sign to avoid a false positive finding. A posterior sag sign is present when there is an indentation apparent as a result of a posteriorly displaced tibia, indicating a posterior cruciate ligament tear. This will be presented in a separate video called posterior sag sign.